Hello and welcome to the Dissect and Connect podcast. I'm your host, Mike Wade. This is the podcast where we explore population health issues impacting your community. Dissect and Connect is a service of New River Valley Community Services and the Montgomery County Prevention Partners. Dr. Elizabeth Reynolds is immediate past president of the Virginia Dental Association. A dentist in the Richmond area, Dr. Reynolds has been deeply involved in the association's response to coronavirus and has been an active supporter of the association's Mission of Mercy initiative since its inception. Dr. Scott Miller is a prosthodontist in private practice in Bristol, Virginia. He is also the clinic director for the Appalachian Highlands Community Dental Center, which he helped to launch in 2020 in partnership with Ballad Health, Johnson Memorial Hospital, and Mission Dental Virginia Incorporated. So, Dr. Reynolds, Dr. Miller, welcome to the Dissect and Connect podcast.
Thank you for having us.
So I know I'm in the minority when I say this, but I'm one of the folks who actually enjoys going to the dentist. I actually just had my 6-month visit on Wednesday. But I know not everybody feels that way. So why do so many of us dread going to the dentist?
Scotty, do you want to get started or you want me to?
Sure, I'll take that. To me, I've been practicing dentistry now for about 27 years. And it has to do with the fear of pain and the financial aspect of it, I think, are the two things that prevent people from being in the office. Sometimes you can start working on somebody and they flash back to the little shingle on the dentist who took their first tooth out. And it's really an emotional event for a lot of folks. So if you can help them overcome that fear of pain and give them some options for the financial aspect of it, then people tend to deal with dentistry a little better.
I agree with you, Scotty. I think that dentistry can unfortunately be a little bit intimidating. And sometimes it's invasive because you're right in people's space. And I think anything we can do to make that a little bit more pleasurable for folks and to make it a little less intimidating will certainly help them work through their issues.
So for those who may not have an understanding of this matter, can you discuss the overall importance of oral health?
I think oral health touches every aspect of our lives, but we take it for granted, right? Your mouth is, we all know, the window into the health of your body. It can show all kinds of signs of nutritional deficiencies or general infection, systemic diseases such as diabetes. And I think people don't understand how important that is. So when we look at oral health, some folks think about your smile or just your teeth, and those are important. But a larger issue is that those will show you what could be going on with the rest of your systemic health.
A fellow prosthodontist back in 2015 wrote an article. His name's David Felton. And he wrote an article called Complete Edentialism. That's when you lose all your teeth and the comorbidity, the diseases related to that. And he found that there's several other things that can happen when you don't have any teeth at all, and you have higher incidence to number one things is diabetes and obesity. If you don't have any teeth, your ability to chew disappears. So all of a sudden now you're taking in more foods that are higher in carbohydrates and less nutrients, and that leads to obesity and diabetes. Your nutrition decreases. He also found that folks that don't have any teeth are at higher risk for COPD related events. And now with the pandemic and COVID, having breathing problems is not something you want to have right now. He also found that you're more likely to have increased in pneumonia related hospitalizations. Cardiovascular disease was another. People lose their teeth. Their ability to be employed goes down. People want somebody meeting the public with a nice smile on their face to represent their companies. And if you don't have any teeth, then, there's a whole cascade of things that can happen. So making sure that we have people educated to take care of their smile, like Dr. Reynolds says, the start of a healthy body starts with a healthy mouth.
Dr. Reynolds, anything to add to that?
Oh, no, I absolutely agree with Dr. Miller. Those are such important issues. I do think in this day and time, the one thing that we are seeing as well is folks without teeth do tend to have a higher incidence of depression because they're isolated. And in this environment, isolation is such an issue to begin with. So I think that you have to look at all aspects of your oral health for sure.
Dr. Miller, you talked about, I guess, the extreme end of things if an individual loses all of their teeth. But what are some other things that we might experience if we don't take care of our teeth?
Well, you have a higher incidence of abscesses of the teeth that can spread to other areas of the body. Especially the teeth are so closely in relation to the brain. You definitely don't want to have any sort of uncontrolled abscesses in the head and neck area that can affect other spaces and spread. Dental pain is a motivator that overcomes the fear in finances. A lot of times, people with a toothache, it just dominates. It dominates your thoughts, and people that have the most fear of a dentist will still come to see the dentist when the pain reaches a certain threshold.
Yeah, that can get to a point that it's hard to look past, for sure. Dr. Reynolds, anything to add to that?
I think that the concern is that a lot of times people wait until they have that pain before they show up at the dentist. And that is what puts us all in a difficult situation. So I think that's why it's so important to work on preventative maintenance, to make sure that you're going to the dentist every 6 months at the very least, to make sure that that nothing progresses into a situation where you have to move on to having a tooth extracted or where the tooth abscesses and you're in pain or you end up in the hospital.
An ounce of prevention is worth a pound of cure, right?
Dr. Miller, you also mentioned early on in our conversation today the issues around financial concerns and how sometimes that can be a barrier for people to access dental care. What are some of the other primary issues around that?
Well, we were talking a little earlier. Me and my wife both are from Southwest Virginia. I grew up in Russell County, and she's from the coal fields over in Buchanan County. Both our fathers were coal miners. And one thing that affects us here in Southwest Virginia is just the access to care, for one thing. And then the other is basically access to money and good paying jobs. There's talk of different businesses moving in. We'll be getting a casino soon, I think, that'll help with some employment issues. Of course, there's the other side of the coin to that can be debated later. And overall, access to care here has to do with the number of dentists in our area. In the United States, there is 100. For every 100,000 people, there are 61 dentists. Virginia has a little better average. There's 63 dentists per 100,000 people. But in the case of the 11-county region that makes up my area in Southwest Virginia, that includes Buchanan County, Dickinson County, Grayson, Lee, Russell, Scott, Smith, Tazewell, Washington, Wise, and Wythe. So all of the southwest of the Roanoke area where you're at, we only have the ratio of dentists is per person is half the state amount, and that's only 29 dentists per 100,000 people. So the absence of dentists in this region produces a big void in access to care for patients here.
So what attributes to that? Is that just a matter of individuals not going into that profession, or what's the story there?
I think it's recruitment to the area has been an issue for us. People that are not from Southwest Virginia really don't want to come to Southwest Virginia to live, especially if they're from a larger urban city area. But the one thing that has changed is we now have a residency program here in Abington that has recruited some dentists from other areas. So I think that is definitely going to help with the access to care problem.
Dr. Reynolds, I'm curious to hear your take on that around access to care.
I think that Dr. Miller speaks perfectly about what is going on in that part of Virginia. There definitely is. The access to care involves both finances and availability of dentistry, of dentists.
Mm-hmm.
I think that access to care in Richmond is very different. it tends to be more financial and not dental specifically related. We are working very strongly to develop an adult Medicaid benefit, which would be meaningful to the patient and provide the correct care that patient needs. And I think that is an important part of what we can do to help that group of folks, that population that can't get access. We have also put together, through the Virginia Dental Association, missions of mercy across the state, which have proven to be tremendous assets to that group of folks who cannot get access to care. They go from Northern Virginia all the way to Lee County. I believe there's one even in Lee County. Those have been an unbelievable benefit to these folks. Unfortunately, COVID has had a tremendous effect on our ability to do that this year. Until we get COVID under control, we won't have the ability to do those traditionally the way they have been done before. Dr. Miller certainly can speak towards some of the things they're doing out there in lieu of the missions of mercy, I believe. And Dr. Miller, I'd love for you to speak a little bit about your residency, because I think you're not quite telling us all about it. It's a tremendous thing that you've developed out there.
Well, I got involved with the Mission of Mercy probably about 15 or 16 years ago through one of my mentors, Dr. Terry Dickinson, who was the guy who envisioned the Mission of Mercy project that's now spread to many states. But since its inception, the Virginia Dental Association's foundation, Mission of Mercy projects, we call them the MOM projects, they've provided more than $26.1 million worth of free dental care to more than 31,000 Southwest Virginia patients. And that's just at the locations in Grundy and Wise. That include, the other, we used to have one in Roanoke, actually. So they've really helped a lot of my neighbors, and actually some of my family members have even been to those MOM projects. Since the first MOM project over in Wise, 24,423 patients have been treated. 64,453 teeth have been extracted. So my involvement with the Mission of Mercy project, along with Dr. Stephen Aloof up in Roanoke, a colleague of mine, was to try to give those people back their smile and give them some teeth. And that's the reason I'm a prosthodontist, so one of my specialties is the replacement of missing teeth, and that involves dentures a lot of times, especially in my area. That denture waiting list, Mike, had over 600 people on it at one point, and you would have to wait for 2 years to try to get your smile back and get some teeth so you could eat with. I have a colleague, Dr. Mike McCracken, who's a prosthodontist down in Alabama, that started a dental residency program. It's called an Advanced Education in General Dentistry, an AEGD program, through a drug rehab facility called the Foundry down in Bessemer, Alabama. I got to know Mike really well through some dentures that we were training his residents to do, and he needed a sponsor for his residency program. Our hospital here, our local hospital, Johnson Memorial Hospital, which is part of Ballad Healthcare, we presented to them the need to have better access to care, which they know a lot of. I mean, that's what they do. That's their business, is providing health care. So we presented it to them, and they graciously have become a sponsor for our sliding scale clinic here called the Appalachian Highlands Community Dental Center. And we started right before COVID. We opened the day before the COVID shutdown, and then we had to be closed. But as soon as we opened back up, the total patients that we've seen through May through the end of the year, we've seen 942 people at this sliding fee scale community dental center. We have 4 dental residents. We have one that is with me and Dr. Davenport here at South Holston Dental Designs, our office in Bristol. And we have 3 residents up in Abington that are there, and they rotate through our private practice. And it is actually the first AEGD initially accredited by the Commission on Dental Accreditation to have a resident in a private private dental practice. So that's something we're really proud of, and it's really helping a lot of folks. Because of COVID, the Mission of Mercy projects have also been shut down. So once we started opening back up, our clinic has partnered with the Virginia Dental Association Foundation, and we've conducted some mini mom projects. We've actually had 2 mini mom projects. July the 30th through August the 1st, we had a denture event, and we treated 60 patients that didn't have any teeth, and we provided them with 102 arches of dentures. In October, we had an extraction event because a lot of those patients without the ability to go to these mom projects had no way of getting out of pain. So through the Mission of Mercy, this mini Mission of Mercy project in October, we treated 115 people and we extracted 367 teeth. So that was something that we were able to do through the partnership with the Virginia Dental Association Foundation and their great sponsors through Johnson Memorial Hospital, and the Virginia Dental Association's just been so supportive of the folks in Southwest Virginia that's been facing this access to care problem for a long time. And we're very thankful.
That's good stuff. Thank you for sharing that information. So in addition to projects like Missions of Mercy, are there other resources to help overcome those barriers to access?
One thing I would like to make sure that everybody knows is that children who are enrolled in Medicaid have access to free dental care. So there are Medicaid providers, there are many Medicaid dental providers, and they are happy to see those children. So there should be no reason that children can't find dental care. And I think that's so important, because if you establish those kinds of experiences early on and get them into the correct habits and educate the parents, and a lot of times those children won't grow up needing the dental care that Dr. Miller's talking about. We've
talked a little bit about how COVID-19 has impacted the Mission of Mercy program and some other stuff that you're doing. But are there other ways that the coronavirus has impacted dental care?
I think dental care has been tremendously impacted by the coronavirus, probably as much as any other medical specialty. If you've been to the dentist lately, you said you were just there,
right.
You got a good checkup.
Yep.
Your dentist looks very different, and your dental office looks very different. We have established new protocols to maintain the safety of our teams and our patients and ourselves. And those protocols were established by a group at the Virginia Dental Association who took a tremendous amount of time following all of the CDC regulations, OSHA regulations, to make sure everyone is safe. I do want folks to know that going to the dentist is extremely important, even though it is COVID, and that it is extremely safe. Your dentist will look very different. Like I said, we are covered head to toe. We wear N95 masks. We have face shields. The rooms have even more sterilization protocols than we had before. And dentists have always been leaders in sterilization protocols and infection control. We've always led the way in that. This is just taking that one step further. Additional PPE certainly has been a thing. Most of us have outfitted our offices with different types of sterilization, air purifiers, different sterilization methods. We now have patients waiting in cars to limit the amount of folks in the office to establish our social distancing. So dental offices are extremely safe. But for us, as well as when you look at COVID affecting our businesses and our practices, we were shut down for 6 weeks and limited our practices to only emergent care. And that certainly had an impact on dentistry and on folks across the country, across our state, but also across the country.
Mm-hmm.
That put people in situations sometimes that even just that 6 weeks put people in situations where something routine became emergent. And that is what we don't want to continue to happen. So I think that that COVID had an impact that way on our ability to care for our patients in a timely, preventative manner.
Yes, when I went to the dentist on Wednesday, I was met at the door, given the COVID screening, temperature check. So I felt very safe in that environment. So besides going to the dentist every 6 months and brushing, flossing, doing our daily care, what else can we do to protect our oral health or improve it?
Well, I think diet plays a key role in into oral health. I mean, decay and disease don't stop. They never shut down. They continue on. And, the way tooth issues start is through too much acid, too much acidity in your mouth. They can come from either from your diet, from nutritional intake. One of the strongest acids that can destroy the enamel on teeth come from your stomach. So people that have a lot of acid reflux can destroy their teeth really fast. Eating disorders can also create havoc on the teeth really quick, the enamel on your teeth. So I think a lot of that has to do with educating folks on the importance of a good diet, a balanced diet. Not a whole lot. The one thing, you go to Walmart and get a 2-liter bottle of Mountain Dew for 79 cents if you can catch it on sale. But you can't buy a bottle of water for less than $1. So I think a lot of it has to do with, what you get the biggest bang for your buck. But it has to do with nutrition and nutritional intake.
Anything to add to that, Dr. Reynolds?
I couldn't agree more with Dr. Miller. I do think that nutritional intake is so very important. And the food deserts across our state certainly play an important role on the inability of folks to get healthy food some places. And just what Dr. Miller said, it's more economical to buy that 2-liter soda than to buy that water or something that's a little healthier. The other thing that we have seen throughout the coronavirus pandemic has been an increase in clenching and grinding and fractured teeth. So I think the stress, a lot of folks exhibit their stress through clenching and grinding. Please be aware of that. If you have issues when you bite and you have sharp pains or you're cracking and breaking your teeth, we can help with that too. Certainly that adds to tooth loss in the long run, most definitely. So talk to your dentist, get a night guard over the counter, protect your teeth as best you can. Use fluoride rinses, make sure you're brushing and flossing every day, twice a day. Just standard home care to make sure that you take care of your teeth when you can't come in.
It's an interesting point around the stress-related issues that you're seeing.
Dr. Tammy Chin, September the 8th of this year, or of 2020, had an article, I think it was in the New York Times. It's called "A Dentist Sees More Cracked Teeth, What's Going On?" And she describes patients of being restless and not sleeping well just because of all the stress from COVID and what it's done to businesses and, family members, losing family members. And it's just putting your body in this fight or flight response where you're always tense. It's like you ball your fists, you clench your jaws, all that stress goes straight to the teeth. All that tension goes straight to the teeth sometimes. And I have seen a higher incidence myself in my practice of people having cracked teeth and broken teeth just from, I guess, their subconscious takes over. I also tell them now, I've added to the oral health instructions, if I'm seeing people grinding, to stop watching the news. I think I was grinding my teeth a little this week too.
It's probably good advice for all of us, regardless of our teeth. Hey, any recent major advances in dental care that our listeners should know about?
I think digital dentistry is changing how I was trained. I mean, we've got all these new residents. We've got 2 residents from the University of Maryland, one that came from Virginia Commonwealth University, and one from UAB. Next year, we've got a dentist from Minnesota coming to the area. We have 2 coming from the University of Louisville and another one from Virginia Commonwealth University. These young folks are all interested in digital I mean, they're all social media gurus, and they love digital dentistry. We have now, instead of impression material that you have to put in your mouth to get an impression made, we have digital scanners. So people that have a strong gag reflex, you don't have to have all that goop put way back in the back of your mouth. Digital scanners. But one thing we're seeing now is the materials in dentistry have gotten stronger and prettier, actually. A lot of the crowns now are made out of a material called zirconia. It's replacing porcelain fused to metal crowns. And those things can be milled in the office. A lot of dental offices have their own mill, so they can prepare your tooth, take a digital scan of that tooth, design what that new crown's going to look like on a computer screen, push a button, and all of a sudden, out of a block of this material, this machine mills that crown right in your office, so you can have same-day crowns. Same way with the dentures. There are digital dentures being designed now that if a patient loses their denture, they don't have to go back through that conventional 5-step process. We can call the company the lab that milled that denture to start with. They've got that file saved. So all they have to do is reload it on the computer, press a button, and it mills another one. So the advances are making me feel like an old man quick.
Tough to keep up, isn't it, Dr. Miller?
Yeah, it is.
Well, that's pretty amazing technology. Any suggested resources for folks that are interested in learning more about dental care, oral health?
My favorite resource to recommend is mouthhealthy.org. It is a great resource put out by the American Dental Association that answers so many questions that you could have, and you can get on it. And the website is beautifully done. It's easily navigated. It's a great place for folks to go to get answers to all kinds of questions.
Excellent. I'll be sure to include a link to that in the show notes for today. Dr. Miller, anything from you?
Virginia Dental Association dentists are probably a good resource too. So make an appointment to see one of us.
Either in person or via teledentistry.
That's exactly right. We can do it.
So interesting that you brought that up. Tell me how teledentistry works.
We haven't quite been able to put crowns in or fill teeth yet via teledentistry. We're not quite there. But it has worked beautifully, especially through the pandemic, for folks who had issues that weren't identifiable to them. They can call us, Zoom us, FaceTime us, and we can look at the issue. And then a lot of times we can identify it and treat it through antibiotics or antibacterials or whatever we need to do. Or let them know it's not emergent, that it's something that's not as frightening as they think it is. So that has certainly been helpful for me. And I think it's helpful down in your area, isn't it, Dr. Miller, for folks who don't have access, who can't get in your 8 inches of snow tonight, get to the dentist.
That's exactly right. Especially through the COVID shutdown, we were having patients, that would take a selfie of their face, take a selfie of their tooth, and text that to us so we could kind of access things or assess things to see exactly what their need might be and to see, what level of care they needed. So the one thing with teledentistry that I've seen change in my career is we used to mail x-rays to each other, and, you'd have to send that in the snail mail and respond in writing. And now you can, through a secure HIPAA compliant email, you can send photos and radiographs to your colleagues, and it helps treat that patient quicker. So that's something that we use on a daily basis.
Gotta love that technology.
Yeah.
Love-hate relationship for sure.
I don't think there are many who would argue that. Well, thank you both so much for your time. You've been very kind to spend part of your day with me. Any parting words of wisdom that you'd like to share with our listeners before we say goodbye?
Well, tooth decay and stress don't really heal themselves. The source of stress, we got to try to eliminate that and prevent it, whether it be coming from the COVID pandemic or tooth loss in Southwest Virginia. So I appreciate the opportunity to be able to share the information about our Appalachian Highlands Community Dental Center. We have a Facebook page that people can go to get our location and some information about that clinic if they have financial limitations. We will become a Medicaid, an adult Medicaid clinic, and hopefully in this session of the legislature we'll have some money available that'll help treat folks that don't have any teeth.
I guess just to add that dental care is essential to your oral health is essential. So the longer you wait to treat an oral health issue, the more difficult and expensive it can become, and the more dangerous it can be to your overall health. So take care of yourself and take care of your teeth. And Mike, thank you so much for having us and for offering to let us get all this information out to folks. We hope that it's helpful for them. We really appreciate it.
Thank you, and maybe we'll have you back at some point in the future to talk more about this.
Sounds good. Thanks, Mike.
Dissect and Connect is sponsored by Teen Connections, a leadership program through Planned Parenthood South Atlantic that empowers youth with the facts about sexual health and the skills to build stronger, healthier relationships. It's free, totally virtual, and you can earn $100 when you graduate as a Teen Connections peer educator in your community. Join a Teen Connections program from home today. For more information, be sure to check out the show notes from today's episode. We hope you've enjoyed this episode of the Dissect and Connect podcast. To learn more about Montgomery County Prevention Partners, our New River Valley Community Services, be sure to check us out on Facebook or visit nrvcs.org/podcast.